Hi, Zion.
A quiet moment with her youngest. Or playtime with the big kids.
This is the game.
All of it for Isis Finley.
Good job.
Is special.
I love you.
Oh, I'll take that.
Being a mother completely changes you because you, from that very first kid, you just don't think about yourself.
And have you always wanted to be a mom?
Yes.
Now a mother of 5, Finley says she knew raising a child would be expensive. What she didn't account for is how much it would cost just to give birth.
Probably like $6,000 or $7,000 after insurance covered it. And I just remember leaving the hospital like, whoa. Not only are you trying to figure out how to be a mom, but then you have this added stress of, okay, I don't want to be in debt.
So she's not surprised by research that found new moms are twice as likely to have medical debt as young women who did not recently give birth. Finley recalls setting up a payment plan for those out-of-pocket expenses when she had 2 of her kids with private health insurance, and then a vastly different experience with her other 3 children because at that time she was enrolled in Medicaid. The government-funded program provides health coverage to low-income families, and thus, Finley says her labor and delivery costs for those pregnancies were fully covered.
I think it's outrageous.
Does it speak to the system being broken?
Oh, yes.
The healthcare system?
The health, absolutely.
Search the phrase birth bill or baby bill on social media and you'll find plenty of other parents who feel the same way.
So the total cost to have a vaginal birth with an epidural with insurance in America is $22,346.
This new mom out of Utah sharing screenshots of each invoice and the amount she's now on the hook for after insurance.
$7,411.84.
The costs are staggering, and this has been a problem for years and years.
Erin Mackay is with the nonprofit National Partnership for Women and Families and says the big bills associated with pregnancy and childbirth can also have an impact on maternal outcomes, citing instances where women have delayed or skipped prenatal and postpartum care because they simply can't afford it.
Maybe it's for the prenatal vitamins. Those costs can really add up when you're pregnant. The ability to go see a mental health provider, to be able to check in with a nurse or a doctor on complications in the year after childbirth is incredibly important.
Her organization and several others have endorsed a new bipartisan effort on Capitol Hill. The Supporting Healthy Moms and Babies Act aims to make childbirth and related maternity services free for families. If approved, it would prevent cost-sharing requirements for prenatal, childbirth, neonatal, perinatal, and postpartum health care by designating those services as essential health benefits and requiring private insurers to cover them the same way that Medicaid does.
It puts mothers in a position where they can focus on their care and the care of their baby without having to worry about how they're going to pay for it.
Democratic Congresswoman Jennifer McClellan and Republican Senator Josh Hawley among the coalition of lawmakers who co-sponsored this legislation.
They would say, nope, insurance companies can't do it. You can't charge all those out-of-pocket fees. And it would help families. It would give them a leg up, give them something to stand on when they're trying to get their family started.
Meanwhile, according to the CDC, birth and fertility rates in the U.S. have been largely on the decline. The nation's GFR, or general fertility rate, dropped 22% from 2007 to 2024. And as that issue has gotten a lot of recent attention from the Trump administration, some Republicans have suggested this free childbirth bill could be part of the solution for that, too. Senator Hawley, though, stopping short of making that connection.
Do you think this legislation reducing childbirth costs could also help address declining birth rates?
You know, I don't know the answer to that. I mean, it'll be up to families to make their own decisions.
We also asked experts at the Population Reference Bureau for their insight.
It would be unlikely to have a real measurable impact on the actual birth rate.
As someone who studies population data, PRB President Jennifer Shuba says the financial decisions of starting a family are not that simple.
The costs associated with having children, they don't begin and end just with birth.
Okay, so it's a sage.
a challenge that Isis Finley says many moms and dads deal with every day.
Now childcare, what am I going to do for that? Can I afford formula or diapers? Like, it's much more than that, and I think that's why birth rates are low.
Now you gotta open it.
Yet as she reflects on her own path to motherhood, Finley says she does support the current push to make childbirth free, and she hopes it will help moms and babies
My little boy.
be healthier and happier from day one.
They should not have to think about, like thousands and thousands of dollars after the baby comes. So I think this bill will help mothers significantly with just avoiding that stress.
Now, if this legislation is approved and makes childbirth free for people with private insurance, one big question is whether insurers will then pass those costs on to all plan participants by raising premiums. The Niskanen Center think tank analyzed this proposal and concluded it would likely lead to a modest increase, but called it a worthwhile trade-off. Meanwhile, America's Health Insurance Plans, or AHIP, which is a trade association representing the health insurance industry, has said coverage mandates do tend to raise health insurance premiums. You can read the organization's full statement on InvestigateTV.com.